Hi, Amparo.
Hi, good evening.
How are you?
I'm doing well. Just joining from my phone this time, so I don't have my
Okay.
special background.
Okay. Sorry. Sorry. I don't
Ah,
I'm really bad when it comes to Zoom on the phone. I can't find anything on it, like where to
yeah,
respond. It's just I'm used to it on the computer. Yeah, I always
sure,
struggle.
sure. I get that.
Always,
I get that.
yeah. Mhm.
So funny. Anyway, so
Yeah.
did you get outside at all today?
No, no, I work remotely. This is the problem. If I'm in the office, I go out, right? If I'm yeah, at home, I tend to just stay home, and that's not good.
Oh no, it was
Not
so
good.
nice
Was it
out.
spring-like?
Yeah, yeah.
Oh, okay.
Like the first day where I'm like, I really don't need a jacket, you know?
Oh,
Like,
wow.
yep, just had like
Nice.
2 layers instead of five, right?
Oh, okay. No, I did not. I did not. That's a mistake. I need to go out when yeah, even for lunch or something. I need to go
Maybe
out.
maybe an after dinner little walk, right? I hear
Okay.
that the research states that after a meal, if one takes a couple of steps, your blood glucose, kind of equalizes. So might be
Okay.
an opportunity for you this evening.
Okay, maybe. Absolutely. Hey, Debbie. Hey, Robert.
Hi, I made you co-host.
Thank you.
I'd like to stay, but I can't.
Oh, okay. Okay.
Looking
And this
forward
is
to hearing the update. They asked for the agenda today and everything, so I resent everything. So
okay. All
is
right.
Robert part of the committee? Oh, there's Lisa
Yeah,
Forman.
Robert. Yeah,
Did you
Robert.
have a formal presentation? Do I need to give you co-host?
Yes, yes.
Okay.
Please give Dr. Foreman co-host. Yes.
Okay.
Yes.
Thank you, doctor, and thank you for coming.
Yes, we appreciate it.
I am Carol.
Oh, you can't hear us, Doctor?
Doing well, thank
I think there's a audio issue. I don't think. Yeah. Yeah, you can't hear us. Okay.
you. But
That's
we
not
can hear
good.
the clicking on Dr. Foreman's end. I can.
Can you
Yeah.
hear me? Because I can't hear
Yeah, we
Yes,
can hear
anybody.
you.
yes,
Oh, we
we
can
can
hear.
hear you. We
Yeah, we
can
can
hear
hear
you,
you.
Okay.
absolutely.
Can you hear
I
us
am not
now?
hearing you,
Oh,
Lauren. Let me see here.
oh, is it me? Can everybody
Uh,
else hear me? No?
Wait,
Okay.
I can
bear
hear
with me
you.
for a
I can hear
minute.
you.
Okay.
Let's see.
No.
My my mic is on. Oh, but I can't hear you.
Oh,
Huh.
that's not good.
I have no idea why I'm not able to hear you. Microphone? Yeah, it says the microphone is on.
Oh, she just froze on us though, right?
Yes.
Okay. Maybe she can come back in. Maybe that will help. Yes. Oh, she's coming in another way. She's here twice. Hi, can you hear us now, Dr. Foreman?
Lauren, I gave you co-host and Patrick co-host, so I'm going to jump off and you'll be host.
Okay.
All right.
Thank you.
Have a good meeting. Thank you.
Okay.
Bear with me for a minute. I'm not sure what's going on. I'm so sorry. Lisa, doctor,
Let
we
me
can
try
hear you.
closing some of my other
Yeah.
work and
Okay.
let's see. And add reaction, share screen more, settings, audio, test speaker. No.
Any thoughts, Patrick, when we can hear the person and they can't hear us?
No, I mean, if their volume's on,
And you can hear me.
yeah,
Yes.
yeah, and their microphone's on, so
Yeah.
yeah, that's usually it. I mean, there
This
could
is
be
not
some
working. I'm so
Zoom or
sorry. I can try from a different computer.
Okay.
yeah, probably. I
Okay.
was gonna say it's
Yeah.
probably some local like software is not updated.
You cannot.
100%.
I cannot hear anything.
Yeah,
I'm
yeah,
so
no.
sorry.
No
Yeah.
worries.
I'm gonna
Okay.
log off and try
Okay.
from a different computer. Give me 1 second. So
Okay.
sorry.
Okay.
That happens
Yep.
to me when I have headphones plugged in sometimes. Like,
I thought about that, like where the output was, but then I thought that might be a little too laborious for this crowd. Just like consign it to local user error, and if there's a different device and it's working hunky dory, leave it at that. And I don't know Dr. Foreman, so I don't have that rapport. I'll spare her. You guys might be a little closer for that. There you go. Exactly.
So, but she's in twice. I mean, she was in twice too, so I don't know.
Yeah, it could be some sort of like if the software is not completely up to date, it could be a little funky. I don't know. But then again, I'm on a 10-year-old laptop and I've not updated my stuff in a while, so
Mhm.
no comment, frankly.
Okay. Okay. That's taking a little bit. Okay.
I can hear you.
You can hear us?
Yes.
Okay.
and we
All
can
right.
hear you.
So sorry. I don't know. That's very odd because I use that computer to call patients and I've never had a problem. But now I can see you and I can hear you.
Okay.
Hello, everybody.
Hello.
How are you? Sorry about that.
Not a problem. Okay, so I know you're in here twice because we have another box, but do we
Okay.
need to make her,
you-
can we make her, okay, let me see, can we make you co-host?
I'm fairly.
Yep, yep. Okay, yep.
I'm not so high tech when it
Okay,
comes
that's
to
all right.
this.
Okay, so you should be able
So
to share.
hello.
Hello.
Hi, everybody. I'm Dr. Foreman. I'm a pediatrician at Elmhurst Hospital. Dr. Bertiliano asked me to give a sort of a brief discussion of measles. I think that's on your agenda, given it's a hot topic. So I'm happy to. I prepared a little presentation. I sent it to you, and let's see if I can manage to share my screen. So let's do here. Okay, bear with me for a minute here.
Oh, and Dr. Foreman, let me just say this one thing.
Yes,
It's like, welcome
sure.
to the, what is this? March 10th, 2025, meeting of the Health Human Services Education and Unhoused and Shelter Task Force Committee meeting. Okay. You
Thank
might need
you.
to have that for the record.
Nice to know.
Okay.
Now, let's see. Okay, share screen
Mhm.
and entire screen here, which is good. Also share the audio system. Okay, here goes. Why is it not letting me? Oh, no. Window and Microsoft Edge tab. Let's see if I can share. Oh, I can only share one thing at a time. There we are. Okay. So let's see if I can do this correctly. It says I'm trying to share and it's not letting me. Oh my goodness. Share screen. It's very odd. This is not my night in terms of tech. It is not letting me share my entire screen, so I'm going to have to do the window. It's very odd. Huh. I really wanted to share my whole screen so I could toggle. There we are. Okay. It's so weird. It's not letting me click on it. What is with the Zoom? We don't use the Zoom app from the hospital, so it makes it a little bit. We're using it from the website. So let's see if it lets me just do the slides. I may lose you and have to rejoin because it's not letting me share my entire screen. Yep. All right. Can you see the slideshow?
Yes.
Yes.
Understanding
Okay,
measles. Yes.
Okay, great. So I may lose you to join you after this. And I may lose you on the link. So I'm going to run through it without clicking on the links. I needed to be able to share my whole screen, but I'm not sure why it's not letting me. Let's see here. Let me just see new share entire screen. I really would love to. No, that's really frustrating. Okay. All right. Okay. So my name is Dr. Foreman, and I'm a pediatrician here at Elmhurst Hospital. I've been here for going on 26 years, 25 years after I did my training at Mount Sinai. I'm a general pediatrician, and I created a complex care clinic under the tutelage of Dr. Wasserman more than 10 years ago. So I teach residents, I see general pediatric patients, and I also see patients with complex care needs and premature babies. So measles, have I ever seen a case of measles? I have not. And actually, neither have any of my colleagues here. And I'm 55. So that speaks to the efficacy of the vaccine. So most of us have not seen measles. Are we ready? If cases surge, I hope so. Because it's, it's really, really, because there's such a surge in the incidents and there is an outbreak throughout the country right now. I think pediatricians are really on guard. And we've been taught and we read, but my generation has never seen measles, at least not unless we've lived through an outbreak. However, I can tell you that the older generation certainly has. And my dad, who is my tutor and my mentor, who's 90, who was a general pediatrician for decades in the 50s, 60s, and 70s, and then became a pediatric oncologist, really could tell you anything you needed to know about measles. And now we don't see it. So there's a difference between, the 60s and 70s, and after the measles vaccine was created in 1963, I think. So in 2000, it was considered officially eliminated, basically due to the MMR vaccine, which is a combination vaccine that includes measles, mumps, and rubella. And the vaccine was initially produced in 1963. Since then, there have been outbreaks, small outbreaks over the years. And in recent years, New York City, we had an outbreak in 2019, and now we're actually seeing cases in New York. Not a lot, but we are seeing them. The current outbreak in Texas is alarming, as well as the very, very low vaccination rate compared to years before. So the last big outbreak in New York City was in 2019. We had over 600 cases, no deaths. We haven't had a death from measles or a pediatric death from measles in I don't even know how long until now. And as we know, there was a child who died in Texas, an unvaccinated, otherwise healthy child. And then I believe there was an adult who most likely died from the complications of measles in New Mexico. So obviously, it's not just a rash, and it can lead to life-threatening complications, even in healthy people. And it's incredibly contagious and dangerous. It's more contagious than the flu and COVID and chickenpox. And it sort of can, I don't know how to say this, it's airborne. It lives in the air for 2 hours. So if you are in a room with somebody, or even in a room where a person with measles was within 2 hours, there's a 90% chance that you will develop measles. You will be infected. So here's just a quick rundown of things that I will talk about today. Most importantly is preventing it. And the key to prevention is vaccination. So what is measles? It is a very contagious viral illness. And it's known, everybody knows it, for its distinctive red rash, right? This is a baby who you're seeing the face of a baby with measles. And it primarily affects children who are not vaccinated.
Oh, I'm sorry,
But
Dr. Foreman, we're not seeing the PowerPoint slides anymore.
you're not.
No.
Oh, what happened to this? This is really so frustrating. I'm so sorry. I don't know why this is not. Are you seeing them now?
Yes.
Okay, I don't know what's happening with this. This Zoom is not ideal here.
Okay.
So anyway, we talked a little bit about how contagious it is, about the rash, this is the rash on the face, which is a rash that starts on the head and spreads to the feet, and it usually starts a few days after the first symptoms. People with measles are miserable. They're really, really, really miserable. It's spread through respiratory droplets. So it can live on surfaces when a person coughs or sneezes or even breathes. And like I said, it can live in the air for 2 hours. And it can be transmitted from 4 days before the rash appears until 4 days after it emerges. So you can easily have been exposed and be infected with measles and feel entirely fine for 4 days before, or even 3 days before you start having any symptoms. So it's a virus that we don't have an antiviral for measles. We have an antiviral for flu, and we have antivirals for COVID. We don't really have anything for measles or mumps or rubella. What we have is supportive care. And it can lead to severe complications. And people who are immunocompromised, pregnant women are at the highest risk. So in terms of community protection, raising awareness is by far, raising awareness about vaccination is probably the most important element of prevention. So it typically begins with a high fever, and it can be high like the flu, 104, 105, and a terrible cough. And my dad was telling me last night, when he was in practice in the 60s and the 70s, the mothers would bring the kids in and they were miserably coughing with a very high fever. And as you can see here, he would look in the mouth and you would see these little spots, these little red spots with a white dot. Those are called Koplik spots. And he would look at the parents and say, expect a rash, it's measles. So it usually presents with fever and cough and possibly Koplik spots. And then a few days later comes the rash, starting at the head and heading down. And it can last for 7 to 10 days, and it starts to fade after a few days. So most people who get measles recover, right? I mean, and it was a common childhood infection years ago, but some suffer severe complications. And like I said, young children, pregnant women, and those with weakened immune systems. Common complications are diarrhea, right? Cough, pneumonia, ear infections. And severe complications do occur. And that's why we have deaths. And it's not a minor viral illness. It's very serious. And there's a reason why the reason why we push the MMR vaccine so much. It definitely can lead to pneumonia. And the most common presentation is fever and cough. And this is a very, very, very common complication. 1 in 20 children with measles will develop pneumonia. And it's the most common cause of death. Encephalitis, right? And encephalitis involves the brain and irritation of the brain and its linings, and it can cause seizures and obviously permanent brain damage, leaving you with cerebral palsy, leaving kids deaf, blind, or disabled. It can lead to blindness, particularly in malnourished children. Nearly 1 to 3 in every 1,000 children who is infected with measles will die from respiratory or neurologic complications. And when you're pregnant, you cannot receive a live vaccine. So we highly and measles during pregnancy is terrible, and it can cause preterm delivery, low birth weight, and worse. And then there are some rare but long-term late complications. One is called subacute sclerosing panencephalitis. So measles outbreaks, and why do we have them? We really see measles outbreaks due to lack of vaccination and dips in herd immunity. So the biggest outbreak New York City had was in 2019, and we had 600 cases. They were primarily in Brooklyn and Queens, where the vaccine coverage had fallen below necessary levels. A lot of these were in religious communities, and the New York City Department spent $6 million, addressing this. And now again, we are seeing it, and there's no question that we will see a surge similar to other places in the country if we don't have good vaccination rates. And I think people are hesitant to vaccinate, although this is such an old, outdated issue. But still people are confused and feel and have a false belief that the MMR vaccine is somehow associated with autism, which it is not. It was one study. It was fraudulent. The doctor was paid to do the study. He lost his license. And there have been innumerable number of studies since then that have refuted the association. And it is true that kids are often diagnosed with autism around age 1, 2, 3, and 4, which is when we give them measles vaccines. So the real risk is not of developing autism. There's really no risk. The risk is not getting vaccinated. An unvaccinated child is 35 times more likely to get measles, and anyone. So, for example, in addition to misinformation about autism and the MMR vaccine, currently I'm sure you've seen it on the news. There's misinformation about vitamin A. So that vitamin A can be used to prevent measles, which is not true. Vitamin A is used to help children who have a diagnosis of measles and are admitted to the hospital. It does not prevent it in any way, shape, or form. And that is misinformation, and I believe is falsely reassuring to parents who maybe don't want to get their children vaccinated. So I think that it's really, really important that we work on avoiding misinformation, explaining the truth, and encouraging vaccination. Now I'm going to try to click on this, and I might lose you and have to rejoin. Okay? Are you still there?
We're still here.
Okay, let's see what happens when I click on this. Okay. Are you seeing this?
We still see the slides.
You're not seeing the video.
No.
Okay. So that's okay. So I'll try to go back and link the videos later. It's a problem with the sharing on Zoom.
Okay.
So measles activity, you guys, everybody knows Texas and a little bit New Mexico. And this year there are 2 reported deaths. There are 2 cases in New York with no deaths. So if you look here at measles from 1985 to here when it was declared eliminated, and a little blip. Here's the 2019. We had a blip here. That's us here. And then now, if you look here, and look in 2025 here, the yearly cases, yearly measles. So look at the difference over here, right? Around 220 and 2025. So how do we prevent measles? With the vaccine. It's really the most effective way to protect children and communities from measles and its serious complications. It's the most effective way. 1 dose is about offers 93% protection. 2 doses offer 97%. And most people who receive the measles vaccine will have lifelong immunity. Most people. The CDC recommends the first dose at 12 to 15 months. We give it at 12 months if we can, and the second dose at 4 to 6 years, although we all give it at 4 years, particularly now. And anybody can get a vaccine anytime. And if you've had the vaccine and you're not sure, you can get another vaccine. We revaccinate kids who are immigrants here at Elmhurst Hospital when we don't have evidence of prior vaccination. And these children get duplicate and triplicate vaccines, and it's perfectly safe. So leaving the country, you need to have 2 MMR vaccines. This has been the recommendation from the CDC for decades. So if you're leaving the country and you're between 6 months and 12 months, then you won't have had your first vaccine. So you should get a vaccine. Your pediatrician can give you 1 vaccine, which will have to be repeated at 1 year, but you can at least have 1 leaving the country. And if you are between 1 and 4, if you're taking your kids to another country and they have not had their second vaccine, they should get their second. 4 weeks after, at least 4 weeks after the first, at least 2 weeks before leaving the country. So a 15-month-old, a 2-year-old, and a 3-year-old should not leave the country without having their second MMR. And that second MMR does not need to be repeated when they are 4. That is acceptable for the Department of Education. And the more we vaccinate, the greater the herd immunity we have. And of course, hand hygiene, right? Washing hands, avoiding close contact. I think people who have measles are, once we see it, people are going to be quarantined and staying home. And it's very important for the community to stay up to date on vaccination schedules and updates. I do personally wonder, I don't fully understand why Texas is not having a booster recommendation. I would not be surprised if there is a significant outbreak for adults to have a booster. I can tell you that our antibodies wane. That does not mean we are not immune, but we definitely have waning antibodies as we age. So understanding the symptoms, the complications, and how important vaccination is, I think can significantly reduce the incidence of measles. And combating misinformation. It's really important. The vaccine is safe. It's one of the best vaccines we've ever had. And it's very, very, very effective. And, the general public parents often have hesitancy about vaccines and they're confused. But when I often talk about the flu and the COVID vaccines, and I try to explain to parents that some vaccines prevent the disease and other vaccines prevent death and serious illness from the disease, I use polio and I use the measles vaccine as an example. When you are vaccinated against measles, you do not get measles. When you're vaccinated against COVID and you're vaccinated against the flu, you very well may get COVID or the flu, but you most likely will not die. But measles, the measles vaccine works. The virus is not mutating. You have the vaccine, you are protected, similar to polio and tetanus and whooping cough. So I'd love to show you some of these videos. I'm just not entirely sure that I want to see if I can do advanced sharing options. I would love to share you these really nice videos, but it just, for some reason, such an odd thing. It does not let me. It just does not let me share. And there's some great links in that. I wonder if it'll let me share the window. Do you see anything different right now?
Yes, we do.
What do you see now?
We see ourselves.
Yourselves. You don't see me.
We do not see you. We see your screen.
Okay. So that did not.
No,
That
that
did
is
not
good.
work.
That's actually good because we know we don't just see the screen, we see your whole internet browser. So if you play the video from
Okay,
a
so
different window,
try
that
this.
would work.
Oh, yeah.
Let's see. I
Yeah.
was hoping, so maybe I am sharing my whole screen. Let's try this. Let's see. Can you see this YouTube
Yes.
video?
Yes.
Okay, great.
We just
Yes.
need the sound though, right? We just need the audio. Because we're
You're
not
not
getting
getting
the
are you
audio.
not hearing it?
No.
But you're getting the video.
Yes.
Yeah. Actually, if you want, since it's a short video, you can just share the link in the chat and maybe we can watch it on our own.
Okay.
Or we can
That's a good idea.
share, like Patrick,
great.
you and I can
What a
share
great
too.
idea.
That's the other way.
That's a
We
great
could
idea. I
share.
will share a couple of here. Okay, I have a couple of really fun videos. So here is this one. Okay. Let's see if that
Okay,
should take you
so
to a really nice
okay, so let's see.
Sorry
Okay.
about the technical difficulties here.
Yeah, we could
Trust me,
try. Yeah. So yeah, if you could just put all the links in the chat and then and then
Sure,
Patrick or I
sure,
can share
sure.
and see if it works that way.
See if I can do this one here. I'm
Okay.
so sorry. I actually logged on and you're not getting volume on that,
We're
correct?
just not getting volume, no.
Okay, this is so weird. And I even actually did this from home through, okay, there's another one about vitamin A and measles.
Okay.
Let me share. These are really nice videos. And they're in the, I can share the actual, here's how contagious it is. This is a really nice one. This is
Okay.
this is a nice CDC video. All right, let's see here. And here's a video talking about how contagious it is from the CDC. And I believe that is,
Is it?
I think those are the 3 really nice videos.
Okay.
Before
Yep.
sharing, you can look for sharing audio.
Yes, you're sharing audio before. Yeah, that's the other way to do it. Do you have that as an option before you share it? When you click on the link on your own computer, and then when you start to share, it asks you to share it, like
Right.
to share
And you
audio.
know what's interesting? At the bottom, it says also share audio. When
Mhm.
I click yes, there's the share, the blue share is not blue. It does not let me.
Oh, okay.
It does not. When I go to Microsoft also share audio, when I do this, it's very odd. It just simply doesn't let me click on also,
Okay.
share the audio. And I have
Okay.
no idea why. It's just so, to share audio,
Okay.
share a tab or screen instead. So you have to do each and every one. So I wonder if I can do that. So here, share audio. Okay, so are you hearing this?
That if one person,
Yeah.
Yes.
Yes.
Okay.
90% of people
Okay.
close to
And
that person who are not vaccinated will also become infected. Your child can get measles just by being in a room where a person with measles has been, even up to 2 hours after that person has left. The best protection against measles is the measles, mumps, rubella, or MMR vaccine.
Okay, great. Let's try
Okay.
this.
Okay.
All right, so now I have to do each and every, it must be the system here. It must be at Elmhurst. Okay, so let's try here. Here's the vitamin A.
Relates to measles because there's
You did it.
information spreading about it. I'm Dr. Edith Frecha Sanchez, board certified primary care pediatrician at Columbia University. And here's the deal.
Are you
During
hearing
the
this?
measles infection, the measles virus depletes vitamin A levels in the body. And that is bad news because different tissues in our bodies, as well as the immune system, need vitamin A. Because of this, the World Health Organization recommends that children and adults with measles receive 2 doses of vitamin A from a doctor 24 hours apart to replete the levels and prevent things like eye damage and blindness. But listen carefully, giving your child or yourself a large dose of vitamin A will make you sick. We're talking vomiting, blurry vision, and potential liver damage. It can even land both kids and adults in a coma. Now, I know that measles outbreaks are scary, but vitamin A cannot prevent measles. The only way to prevent measles is the MMR vaccine, which is safe and effective. We're talking 2 doses are 97% effective at preventing the illness, which is why the AAP and the CDC recommend that all children receive the measles vaccine at age 12 to 15 months and again between 4 and 6 years. And if you live in an area with an outbreak, your child can get the measles vaccine earlier. As always, watch out for misinformation and bring your questions to your pediatrician or your healthcare provider. Take care, guys.
Were you able to see that?
Yes. Yes.
Okay, great. And then there's one last one if you want me to try. I'm gonna do this where I have to share each and every one. So wait. Bear with me for a minute. Let me see if I can do measles. Share each and every screen. Wow. Here we are.
We're doomed. Hi, I'm Dr. Jim McDonald, Commissioner of the New York State Department of Health and also a pediatrician. You know, there's an old expression: if we don't learn from history, we're doomed to repeat it. I'm concerned about the measles outbreak in Texas and New Mexico and around the United States. Right now, 1 out of 4 people in Texas ending up with measles are ending up in the hospital. I'm also closely monitoring 2 cases of measles in New York City. The vaccine is the best protection for your child against measles. If your child has not had the measles vaccine or you're simply not sure, contact your healthcare provider today.
Okay.
Okay. Now, can you see me again?
We still see the screen,
Okay.
the share screen. So if you
See if
stop
I
share,
can
okay, now
see
we
if I
see you
can-
again. Yes.
Okay, great. All right. So I hope
Yes.
that I really apologize for the technical difficulties, and can I answer any questions for anybody, or
Yes,
go for it?
please. I actually had one first, and then I'm Paro, and I know also Leticia had one in the chat. But I had a
Yes.
question in terms of when you said something about the immunity, like most people have lifelong immunity.
Yes.
So, and then you also mentioned that what is it? It's something wages as we get older.
Yes.
Was that what you
So
were talking? Antibodies?
yeah,
Yeah, Wayne.
there have been some cases in fully immunized people. So we're not exactly sure why. Even in
Mm-hmm.
people with a normal immune system, it's very rare. But there are some people who are getting measles who are fully vaccinated. There is no recommendation right now for a booster dose for
Mm-hmm.
adults, and there's no recommendation for checking titers to see if your antibodies are up to date. If I will tell you that if you work for a hospital or you work in the healthcare setting, we all are required to have titers done. And my colleagues and my daughter, who volunteered in our emergency room at 16, had no titers to measles, which is very interesting. Now, she had 2 measles vaccines. You can imagine I gave her vaccines, and she had to be revaccinated. So it's a little tricky. So are adults immune? We clinically we believe that adults do not need a booster right now. And oftentimes the measurement of titers, and the CDC will explain that a measurement of titers may not be a true reflection of your immunity. So you may have negative titers but be immune.
Okay. And
So
what is a titer? Like, what is that?
like if
What
you
is?
did a blood test, and you
Uh-huh.
can actually look for something called antibodies, and you can
Okay.
look for antibodies to measles and antibodies to chickenpox. So I may have a negative antibody to chickenpox. I had chickenpox. I'm old enough to have had chickenpox. I didn't have the varicella vaccine. I had chickenpox. So a lot of times, a blood test to look for the body's own production of protective antibodies is negative, but in fact, the person is truly protected. So it's really not recommended to screen people with a test to see if they have antibodies, because the test results are not reliable.
Okay.
Hospital professionals need to have a positive test, even though it's considered not terribly reliable. People believe in it on some level. So I will have to, we will have to defer to the CDC. And right now, there is not a recommendation for adults to get additional measles, mumps, and rubella vaccines. I would not be surprised if they do recommend it for adults in an outbreak setting, even fully vaccinated adults. But right now, the answer is no. And we don't know why the very few people who are considered fully vaccinated develop measles. Maybe they were not given the right vaccine. Maybe the vaccine was ineffective. Maybe the vaccine was kept at the wrong temperature. So we don't know. Generally speaking,
Okay.
2 vaccinations gives very, very, very good protection.
Okay. All right. Amparo, and then we'll also take Leticia's question.
Thank you, Dr. Foreman, for your presentation. I am the mother of a toddler, and something that has come up in like moms groups and among my friends is,
Right.
should we be looking for alternative vaccination schedules, i.e., getting our second doses in our kids sooner rather than later? And should we be asking our pediatricians for that, or should we just wait? What should we
Right.
do, in your
So,
professional opinion?
so right now, there's no reason in New York to get the second dose for a toddler before the age of 4. There's no reason, unless you're going to leave the country. And that even includes Canada or Mexico, even a part of North America, or, you know, leaving the borders of the United States, it is recommended that you have your second be fully vaccinated. So if you have a toddler and you're going to leave the country, you should get, but right now, you do not need to ask your pediatrician. There is no recommendation. If there were an outbreak, and I don't know what's happening in Texas, but I would not be surprised if they are recommending the second dose early. And that is often what's done in an outbreak. But here now in New York, absolutely not.
Do you know, follow-up question, do you know what
Sure.
constitutes an outbreak, or is that more of like a question for the DOH?
It's probably, clusters of cases there's a definition of an outbreak, and I don't know. It has to be a number of cases that are linked in very specific ways. So we are not having an outbreak here. But we definitely did in 2019. We had 600 cases, and it was the cases were all linked, and it was in mostly in one particular religious community. And it can be brought into this country by travelers who are unimmunized, who are coming from other countries. We had polio in this country. If you go to not even a third world country, if you go to a country where there's more measles and you're not vaccinated, and you're in that window period where you're contagious but not symptomatic and you don't know, you come to JFK, you sit on a plane, everybody is exposed, as well as everybody in the waiting room in an office, unless people are very, you can't possibly know in the early stages of infection prior to any symptoms. You would not know. There certainly are days where you are pre-symptomatic, just like COVID. It's just impossible. If you've been exposed, then you just wait and you just look for symptoms. You don't need to isolate. You don't need to quarantine. You're going to wait. And at the first sign of symptoms with a history of exposure, you need to call your pediatrician, not go in. You need to call. That would be the first and most important thing. And if you do go somewhere, and if it's possible, put on a mask, right? And put a mask on your child.
Thank you.
Sure.
So masking would prevent the spread of this as well, then, of
Well,
measles, or to some extent?
yes, absolutely. It's
Okay, all right.
respiratory. It's droplet and
Okay.
it's airborne. So it's
Okay.
you don't think of measles like that, but it is. It's the same as varicella and COVID and flu. We think of chickenpox as a rash, but it's spread through respiratory droplets,
Okay.
among other things.
Okay. And then Leticia, you had asked earlier, is this measles outbreak a result of an anti-vaccination rhetoric?
So I do not know, but I would not be surprised. I would not be surprised given the political climate of Texas. And the vaccination rate simply fell below that which is necessary to prevent an outbreak. And, I don't want to get into politics, but, there's a lot of talk now. There's Robert F. Kennedy, talking about doing new studies looking at vaccines and autism, and his response to the measles outbreak in Texas is frankly frightening to me. And there's a lot going on right now with the NIH, and we're not a part of the World Health Organization, which really, really causes problems with dissemination of information. And I think Robert F. Kennedy is certainly being attacked for this, as he should be, because I don't think he's responding appropriately. But absolutely, their vaccination rate is too low. It just doesn't happen if you have herd immunity, if people are vaccinated. So, and in certain communities, it's due to reported religious beliefs, or fear of many different things, autism. But it's very dangerous. It's very dangerous. I can't even believe, and I was really very concerned, even prior to what's going on in the political climate, about a measles resurgence. And I'm not at all surprised that it's here. I'm not at all surprised. And there's tuberculosis. And we don't have a vaccine for tuberculosis. And there's a big tuberculosis outbreak. I think maybe also in Texas. I'm not sure. It was big. Yeah. So we're going back in time. And we don't have a lot of ammunition for measles. All we have is the vaccine. And we have ventilators. right? We can put somebody on a ventilator. We have advanced medical care, but we still had a pediatric death from measles in this country.
Okay.
So,
Okay. Patrick and then Leticia.
Yeah. I was just thinking, somebody could watch this or hear us and say or think to themselves, well, I'm vaccinated, my family is vaccinated, I'm not really near these communities. Why, this is good to know, but is this all really preventative? Or so, where should I think I'm in the clear. Why should I be concerned? What would be like a good considerate response to that?
so you are probably in the clear and your family's in the clear, but your neighbors may not be. And your churchgoers and your community members, or maybe you're going to have contact with people that are vaccine hesitant or aren't vaccinated. So if you feel that it's that you have a role in the community, in protecting the community, you are in a way protecting yourself by helping others to protect themselves. And if you're involved in a community board, if you're a state representative, if you are a community advocate, you want to promote vaccination, particularly during an outbreak. And as you know, there are some cases of fully vaccinated people getting measles. So there's nothing you can do for yourself or your family right now except to spread the word about vaccination and help people to protect themselves.
Great, thanks.
That's all I would.
Okay. And thank you for that question, Patrick.
I mean, we got him out there, so you got to cover bases. Yeah.
Yeah,
Yes,
absolutely.
No, it's important.
And Leticia?
Hi. So I guess a follow-up to my first question, thank you, Lauren, for reading. Is there like a way to track vaccination in New York State or nationally? Like the rate, especially because New York City looks so different from New York State.
Yes.
So I was just wondering.
Yeah, so that's a good question. Every state has their own sort of vaccination hub on the internet, and not all states are centralized. New York City is, but New York City has its own city immunization registry. So we can see, or someone higher up could see, what every single kid in New York City has received, including undocumented private pediatricians. Private pediatricians are obligated to enter a vaccine. Now, they don't always, but they are supposed to, by law, enter every vaccination into the city immunization registry. It goes into a central registry. So when a patient comes to me, we enter it, the nurses enter it, and it gets uploaded. So we can see in New York City. I do not know what every other city in New York State does and what other states do. In other countries, in Europe, I believe everything is documented, and every single thing. I mean, it's like there's probably much less privacy, but vaccinations are mandatory and they are documented for entire countries. The Netherlands, many countries in Europe, they have socialized medicine. It's very, very different. But so yes, and we give vaccines like water here, like water. We push vaccines, and we have lots of kids who come unimmunized or partially immunized, and they don't leave the office without getting vaccinated.
Oh, I was gonna ask as a follow-up to that. So do the people who have not met the vaccination criteria, do they get like a letter, I guess now, or would they have received a letter that says, "Oh, you're at risk of being,"
No, I don't believe so. I don't believe so. I do not encounter a lot of vaccine hesitancy in this population. Um, but I think, the schools are the Department of Education in New York is very stringent, very strict. And there are very clear vaccines that you need to step foot in school. You don't need to be fully vaccinated. You can even be behind for your age, but you need to be in the process. And you need to have a medical form from your pediatrician, and it needs to say on the form next appointment, catching up vaccines. So kids are not allowed to stay in school unvaccinated. They may be allowed to start school partially vaccinated. Like, I don't believe that a child can start school without a measles vaccine, but I don't believe they have to have had both to start school, right? So I will see them, I will vaccinate them. We write a note saying the patient is in the process of catch-up vaccines, and then they come back in 4 weeks. And then when they don't show, or if they miss an appointment, we can reach out to them and say, and the school won't allow them to stay. I mean, they're usually very good. And they send letters with parents home, and they will keep kids out of school for certain vaccinations. And I'm sure measles is one of them. So
does having measles impact your immunization for other diseases? I don't know. I was hearing something recently
yes,
where someone, yeah.
so it doesn't affect your immunity to other diseases or any of
Mm-hmm.
the other diseases that you've been vaccinated against or have had. However, it does alter your immune system, and it sort of puts a stress on your immune system. And it is believed that for months after having measles, you are not fully immunocompetent, and you are likely to get sick with you are likely to develop the symptoms and become infected with other viruses more easily, and bacteria and everything. Your immune system is sort of really challenged, and not functioning normally. I think it's called like they call it an immune amnesia. So for a period of time, even if you have antibodies to chickenpox and polio and tetanus and the flu, they may not function normally. It's not a permanent state, but it really wipes you out.
Okay.
I think some
Okay.
people believe that happened with COVID. A lot of people believe that when they had a bad COVID, they just would get sick every few weeks after having had COVID for months. It took a while to fully recuperate to a state in which they were not getting sick when they encountered every virus. And I think it's so important to teach about measles and to increase awareness, but we don't want to start a panic. And we don't want, when monkeypox was in the news, I had all my friends were texting me at night, it's monkeypox, it's monkeypox. You know, when you're a pediatrician, 24/7, you get pictures from your friends about their kids and their grandkids and everything. So we don't want to start a panic. And people were really scared about monkeypox. They thought pimples were monkeypox and molluscum was monkeypox. So I do think that we as pediatricians are ready. And I don't want parents to panic, and we don't want parents running to the ER. Is it measles? If it is measles, you're going to give it to everybody in the ER.
Mm-hmm.
And
Mm-hmm.
it isn't like the other common for the mom of a toddler. If you guys are on moms groups, it's different than what we've seen. And there are a few other common viral illnesses with rashes, exanthems, that affect kids that might be confused with measles. But if parents are educated, then they also will know to not panic, right? So I don't know if you've seen
Mm-hmm.
roseola, which is, the super high fever in toddlers. Sometimes they have seizures, mostly high fever, and then the fever's gone and they develop a rash. Starts on the trunk, it spreads out head to toe, and there's no fever. And from the first day of medical school, every medical student is taught in measles, the fever is concurrent with the rash. So it's fever and rash at the same time. First, you have the fever, and then a couple of days later, you get a rash. There are not really a lot of other viral illnesses where you're really having fever and rash at the same time that look like that. And chickenpox, which we hardly ever see, which I'm not sure any of you, I don't know, do you remember? I had chickenpox. I remember it well from the 70s.
I had it too.
It's nothing like
I had
measles.
Yeah.
Right. So you don't, there's not this terrible cough,
Mm-hmm.
right? And the rash, they're little bubbles. They're called vesicles, and they itch. The itching is incessant. The people are miserable from itching, not because they feel like they're going to die and they've got pneumonia and difficulty breathing. And each little spot is discrete. And they're all in different stages. One has a scab, one is a bubble, one is a pustule. That's chickenpox, and it's itchy. Measles is not itchy, and the fever is very high, and the cough is bad, and they're miserable looking. Miserable. It's not, does not look like chickenpox. It does not look like roseola. And we never see mumps and we never see rubella. But those are some of the things that I worry that people are going to panic and confuse the measles rash with. The only thing that the measles rash looks like is what we call a morbilliform rash, which is literally morbilliform means like measles, as an allergic reaction to an antibiotic or a type of an allergic reaction. It's actually called morbilliform because it looks like the measles rash. But hopefully parents will not panic. I just think that vaccination is important. And if you know of any communities that are not fully vaccinated, I just think it's really important not to panic, but to be vaccinated.
Okay. Okay. And then you said if a parent suspects that their child may have measles, to call, not go
Yes.
directly to the doctor, and then doctor will then what advise like how to prevent the spread, like what usually happens at that point.
Correct. I think it depends. If you're doing a video visit and that doctor is astute and
Okay.
you can put the camera in the kid's mouth and they can see cup leak spots and child looks miserable, but they can do a virtual assessment, or if they believe the child is sick enough to need a visit, they can arrange a negative pressure room. You put a mask on the child, you put a mask on the parent. They come through an entrance where they're not walking through the waiting room and they're escorted directly into a room. Everybody is aware. It's much better than going in and exposing everybody. It's so contagious. Just 15 minutes in a waiting room, and that's what's happening in Texas. Even somebody comes into the airport we had an outbreak, I think, from the polio was from, I think, Israel. We had, but we had, I think, some of the cases. We've had measles outbreaks in this country starting from JFK, and you just sit in a chair, right, and then you get up and you go get a coffee and you feel fine. But that air in that area for 2 hours, everybody's exposed. And anybody under a year has really, infants under a year who are breastfed are considered to be relatively protected if the mother is vaccinated. So another reason to breastfeed.
Okay. Okay. Did anybody have any other questions? I'm sorry. No?
And you can reach out anytime, and if you want a vaccine or information.
Okay. Okay, so one of the things, so you sent us a copy of your PowerPoint, and I forwarded it to the board because the community board office, because they want it for their records. Is it
Okay.
also possible for us to share this PowerPoint, or is it, I just don't, or I know,
Sure.
okay,
You can share it with whoever,
okay, all right,
whatever you like. That's
okay,
fine. It's
okay,
just me.
okay,
I'm happy for anybody. You don't need to ask
okay.
permission to share anything.
And then the other thing that we were also thinking about was also to like, so we have a newsletter, is maybe setting up a link to this recording so people will have this information. They'll hear what your presentation, they'll be able
No
to,
problem.
hear that your responses to our questions. So it just as a way
I
to
just
get the
apologize
information
for all
out.
the technical glitching. So
Oh,
they're
no
going to get to
worries,
watch
no
all of that as
worries,
well.
no
No,
worries.
no problem.
No worries at all about that. That happens. But we really appreciate your taking the time to speak with us about this important topic, Dr. Foreman.
My pleasure. My pleasure. And anything else, that I can help with,
Okay.
I'm here. I've been here forever and I'm not going anywhere.
Okay, good. That's good to know. Okay. Thank you for
All
your
right.
work. Thank you for your
Sure.
work.
Sure. Thank you for inviting me.
Okay. You take care,
Take care.
Dr. Foreman.
Okay. Bye.
Okay.
Thank you so much.
All right. Excellent. Good. Did she just leave? Oh, she could stayed. It wasn't over.
It felt like I for a hot second I was like, oh, is the meeting ending?
No, I
Okay.
meant I just meant no. We had a few more things to discuss, and then we can go. Sorry. Is that what it sounded like? I'm sorry. Okay. Board business. Anybody have anything they want to raise? Old business? Okay. There was two things, new business, one of which is not on the agenda, but Amparo, you can talk about that. Just mention this first thing. So this had to do with proposing site locations for automated external defibrillators. And just to give you a heads up on where that's coming from, is this goes back to the January environment Parks and Recreation Committee meeting where one of the attendees had given his testimony about how he was basically, his life was saved. You know, he's a cardiac arrest survivor. A bystander was able to rescue him. FDNY provided professional rescue. And so they administered CPR for 90 minutes. But what he was advocating for was the placement of AED machines in public places as well as also like CPR trainings. And at that meeting, they had the chief of operations from New York City Parks, who was basically saying that this person could submit a proposal as to where these AED machines could be placed in public spaces. And Laura Shepard, the then chair of that committee, was saying that we could like she sort of like referred it to our committee to be able to come up with places that we thought these AEDs could go. One of the things that the cardiac arrest survivor who was EJ said is that he was suggesting like city parks such as Windmuller Park, Noonan Playground, Rainbow Playground. So just wanted to throw this our way to be able to see if anybody had any ideas for placement within our district. And then also the other thing that Laura had suggested us sharing resources on potential CPR trainings, which we could, I guess, do research on. Amparo?
Yeah, I completely agree that places where physical activity occurs should be places that we rate high to put AAD devices. I know that, for example, in schools, they're usually in the gymnasium. So this is something we should particularly be suggesting to put them in these parks, especially I would think where there is the active exercise equipment for adults in those areas. I think those would be really important to do.
Okay. So basically, okay. So all parks within our district in terms of that fits that criteria. Anything else that anybody has any thoughts with that? And then you don't have to come up with anything tonight. Like we can always get back, so you can have time to think about it. Because I know at least for the CPR resources, I don't have anything offhand. Train stations, high. Okay. Traffic areas, train stations. Okay, and Leticia, I'm recognizing what you've put into the chat. Okay, adult exercise equipment. Okay. Okay. Yeah, train stations sound good. Okay. And if anybody comes up, I'm just gonna let Carlos know since he's now the new chair. And just let him know. Okay. That sounds good. If unless anybody has anything else they want to say about that, and then like I guess we can look offline about the CPR
Well, that makes
resources.
sense. Defitting a kid playing dodgeball is like my nightmare. So whoever brought that up, very thoughtful, and I'm happy because if someone just collapses, you just have to know where to turn, who to turn to. So both make sense. The defib and the training.
Okay. All right. Now I hear you on that. Okay. So we can figure out the Red Cross may or may not have been trained by them. Okay. Okay. You know who else may know is like another place. I don't know if Sunnyside Community Services has this, but we can always talk to them because it's like Andrea's not here tonight, but that may be something also to see what their setup is, if they have that, or if they do like CPR trainings or anything else like that. So I think she would be a good resource to ask about.
They probably have equipment
Yeah.
on site, given their senior events and program thing like that. And I even think in like large offices, like are required to have it, I think.
Okay.
Not for us to encourage or promote necessarily in offices, but yeah, I'd be surprised if Sunnyside, if SES didn't have something. But the CPR trainings is I haven't heard of, but it's a idea if they don't have it in the rotation.
Yeah, that's what I'm thinking. And I'm wondering if they don't. I mean, I'm wondering they may. That's what I was thinking. And they may also have some ideas about placement too. That's all. So I think can follow up with Andrea. Okay. All right. Thank you. Amparo, I'm gonna turn it over to you.
Thank you. For a second there, I forgot what I was going to say, but I
Okay.
remember. So, as most of us know, during the full board meeting we recently had, we had many parents and students come from the Q Studio Lab school regarding the play structure that they are not able to access, and about these inordinate fines that they're receiving from the DOE, DOB, DOH, I believe. And so I was wondering if we as a committee could hopefully support them in some sort of way, either through a letter or something. I think it would be powerful coming from this particular committee, right? So it sounded like at the full board, they were just looking for support. And yeah, I would like to just raise it here and see what folks think about that.
I know I'm a guest tonight with this committee, so I'll just kind of take a back seat and let you guys drive. Not
Well,
not to be
after
ducking
work,
anything,
No,
Lauren. I don't want to just show up and start
no,
taking
no,
the
you're
mic.
no, 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 no. No. Feel free to speak and Patrick, I'm fine with that. You know, you're a CB2 voice, so
I mean,
appreciate that.
I frankly would have expected land use to pick up something here and run with it, and I haven't heard any chatter in the last 5 days, 4 days. So maybe it's on folks' mind. But I don't see any reason why not to, be the tip of the spear on Paro and then see if others decide to come on board and how that would look like. But I think this committee will have a unique and direct perspective that others can't,
Yeah.
um, be so eloquent with. So.
And was Carisha thinking about the chairs of the different committees like supporting, or did I hear that wrong on Thursday night?
Yeah. I mean, especially ours.
Mm-hmm.
But yeah, that was something that she was thinking, like, oh,
Okay.
shouldn't it come out of our committee? So
Okay, that's what you're saying. Okay. Um, I'm fine with that. I just feel like part of it also, it's not just the support, it's clarification on, I think for the clarification on what permit is. This is ridiculous. The whole situation's ridiculous. For them to keep getting continually dinged, but with fines and violations or citations, when it's like there's never any explanation as to what it is they actually need. Um, what kind of permit? You're saying that they need a permit. I just find the whole situation is just ridiculous. I mean, so I don't know what the answer is in terms of it, because it feels to me like we also should be like spearheading like the community board, like trying to get an answer to this question is or link them to whoever can give them the right answer and then trying to like expunge some of these citations, because it just feels it's very unfair. If there's an unfair quality to all of this.
Um, oh, sorry. So I had a couple of questions for the lady, but I didn't feel like it was appropriate for me to ask them during the meeting. But I know Q Studio Lab is a for-profit institution. And just because I live like right across the street from them, many of the families, like I personally, you know, don't connect or identify with them. I'm not their intended targeted population. But um the questions that I wanted to ask were like, well, how um what's the relationship between them and the DOE, right? Is it just through the 3K for all, 4K for all? Is there anything beyond that? Do they work as a separate entity from the DOE? Um, besides those two initiatives, and then And then I wasn't sure what where the jungle gym was that she was referring to. Um, like she mentioned it, but and I know that the kids sometimes, because I see them go sometimes, um, walk towards the park, but I wasn't sure if it was like on the other side of Queens Boulevard. Like I had so many questions, and I just didn't feel like it was appropriate for me to take on and ask because all the parents were there, and I didn't want to like press her, to document whatever. Um, and I was also just wondering, like, usually fines they accrue some sort of, I don't know, like interest or something. So like the first fine will be like $50, just for an example, and the next one will be like 100, and then the next one will be like 200, right? And so I was wondering, how much of that is being, how much of that is adding up, and how much in fines have they accrued right as of right now? Because I don't know. My perspective is that they make a pretty penny, and so yeah. But I don't know. I just had like so many questions, but mostly I just wanted to know the relationship between them and the DOE, because the DOE should be helping them identify what are the permits if
Uh,
they're getting grant money from them.
Letitia, they actually mentioned that they report or check in with the Department of Health. They don't actually report or connect with the DOE for whatever reasons. The 3K pre-K items are related to Department of Health, and then kindergarten goes to DOE. Um,
So
so
wait, so the only kindergarten is, I guess, co-facilitated with the DOE, is what you're saying?
yeah, like DOE manages curriculum, schooling, all of that starts from kindergarten onwards, and then pre-K and 3K are, I think, Department of Health.
Because from my understanding and my knowledge is that only public schools run through the DOE, like what we call New York City DOE, right? And so that includes public schools and public charter schools. And then outside of that, anything where that is for profit is not, has no relationships or ties to the DOE. So that's why I was wondering, um why would we pressure District 30 or District 24, or the superintendent for the New York City public schools, if there's no they wouldn't respond for them if they don't have any ties to them.
No,
So I
I'm
was
agreeing
trying to
with you.
figure.
Yeah,
Yeah.
I'm agreeing with you. The
Oh,
DOE, I think, has nothing to do with it.
yeah, because she kept asking us to pressure the DOE, but how if there's nothing, there wouldn't be a reason for them to connect.
Their issues with the DOB, the Department of Buildings.
So
And
maybe
then
I misheard.
no, yeah, no. That's cool. I thought it was DOE related until they got a Department of Health violation because they checked with the Department of Health like they should, and that's when things got extra wacky. Um, so yeah, Department of Buildings is the real question mark, and that's where I thought land use would be appropriate. But since they roll into the Department of Health anyway, like I put in the chat, like Amparo, you're totally right, as ever. And yeah, DOE has nothing to do with this. And Letitia, I think I see a small thread that you're kind of pulling at. Like, if this is a private institution, what should we like? How should, as a government, get involved? But there is a case to be made, and Maury would make the case that like, government should be looking out for small businesses, serving the community and stuff like that, even though they don't fit our demographic. I mean, I don't fit the demographic. I don't have kids, and all the same. So, like, there's that argument to be made as well.
But yeah, I'm all for it. Like you guys can support, and it's an education institution at the end of the day, by all means. But I just had questions.
All right. And then Robert, you had something that you wanted to say, or
Lauren, I'm with you in that they just felt like there were questions basic questions that we would want answered. and it was fair for them to raise wanting help and us wanting more information. I was confused about the idea that after 17 years, somebody called in on them. And so I'm thinking, okay, who would want to call? Which made me think, if, and I'm not sure about this, so I'm just asking for more information. I don't know. Are they renting from All Saints Episcopal Church, which I believe was sold, and maybe someone just wants them off the property and they're just like strong arming the government to do it on their behalf? Now, this is my like,
Okay.
that's my conspiratorial theory. Rejected parent, that's an idea. So I walked past on my beautiful walk because it was beautiful out today, and I got to like,
Okay.
I was like, oh, there's some, and the kids are playing on concrete, and you see like further on, there's like a little, not that big of a deal, like hut structure. And you do feel like kind of bad, and at the same time, you think, this is so not a big deal for someone to like make it their big deal. Maybe this stuff is cut there. There you go. So that was my thought. Is this like a, to some degree, shouldn't like the owner of the lot be getting the fines, not the school itself? That kind of confused me. And so if it's, yeah, who's actually like getting the bill, and why would it be like the renter, not the owner?
Maybe they have the building. I don't, you know, that's a great observation though, and nobody brought that up. Although I think we did keep kind of, well, no, we had plenty of questions for them. But I think the way they presented it, it was like as if they owned the building. Because they didn't even mention like a landlord or something, something like that. I don't know.
Okay. Okay, so where does this leave us then in terms of what we
I
wanted
haven't
to?
heard a motion. So Amparo, do you want to make a motion?
Yeah.
I
Red
mean,
alert? You don't
it
want to do that?
sounds like our committee is divided, and I don't know. I mean, I'm not so sure what to do. I thought that from the full board, it seemed like some sort of support would be not controversial, but I don't want to, I don't want to speak for all of us, and I'm wondering what others feel about that.
Well, that's why I said like we can vote on it if we want to put this
Okay.
letter together.
Okay. And then what would the letter say, I guess? I mean, part of me is like, my feeling basically, I feel like there's I guess my sense of it was more like, it was more so like, how do we connect them to get them the answers that they need? I guess I felt like that was the way to go with this more so. Like, because their thing was is like, we're willing to pay the permit, or we're willing to do, but we need to get the permit, but we need to know what kind, and we're not getting that information. And all they keep getting is just dinged with these because they don't want to take it down, which is where they're saying that they need to go. So is there a way to connect them to get them the answers that they need to that question?
Yeah, and to your point, Lauren, I think that maybe we should ask the office, because the
Yep.
office does have a lot of connections.
Yeah.
And so I'm wondering if from this committee, the ask is to see if the office can connect them to who is the decision maker.
Yeah. And whether or not, like I said, yeah.
Without necessarily, I mean, and Deb, when she sees this, it can confirm, like, she can set her own boundaries. I just don't,
Yeah.
I don't want
Yeah.
anyone thinking, and not anyone here, like Studio Q or whoever, thinking like the office can help
Yeah, it's
solve their
just
problems, point them in the right direct, like,
we need a disclaimer. The
yeah.
disclaimer we need, because Debbie's not here to be able to say one way or the other,
Sure,
Oh,
like
but
that.
the
yeah.
office does have like a history of relationships in a
Yeah.
way that we may not have. And so
Yes.
knowing
Yeah.
that they have institutional knowledge, this is something that we should be really elevating for at the service of our community.
Exactly.
Yeah.
Okay. So do we need to make any that's our recommendation then, is basically to go to the
So
office and
who's
see.
drafting the email to Debbie? With the
I
request.
mean, I'm happy to. I'm happy to. I can
Okay.
draft with your support, Lauren. I feel like
Yeah.
I can draft an email and just send it to
Yeah.
the office.
Yeah. Okay. That sounds good. Okay,
Great.
so that's what
Thank
we're in
you.
agreement about? Okay, to try to, okay. Okay, that works. Okay, all right. Thank you
All
for
right, with
that
that said, should
Okay.
we have a motion to adjourn?
Yeah, I was gonna thank people. Thank you for that discussion, healthy discussion. The children was the wave. Oh, the children, they were so cute. The kids were cute. They were absolutely so adorable. Absolutely right, Leticia. Okay, okay. And then you can do that. Sounds good too, Patrick, with that. Okay, sounds good. All right. Okay, so thank you for all of that. And then, yeah, motion to adjourn.
Sounds good. Amparo's adjourning into the darkness. Yeah,
Okay.
I'll second it.
Is that a turn out the lights? It's like what is that? That's the signal.
I mean, it's getting
Good
dark out
night.
there.
Time to
Good
go
night, you.
home. Okay. Take care, everybody.
See ya.
Okay, bye.